Hello everyone. CML or chronic myeloid leukemia is a perfect example of how medical research can work wonders. A few decades ago, CML was considered almost incurable. But today, with modern medicines, the disease can be controlled so well that most patients live long and healthy lives. In this video, we'll look at the causes, symptoms, and various treatment options for CML. Let's get started. CML develops because of a genetic change in the bone marrow stem cells. When parts of chromosome 9 and 22 swap places, it creates the Philadelphia chromosome, which contains the BCR-ABL1 gene. This gene produces the BCR-ABL1 protein, which makes the bone marrow produce too many white blood cells, like a switch which is stuck in the on position. We still don't know what triggers this genetic change in most patients. It is not inherited and it is not passed on to children. Most people don't have any symptoms in the early stages. As the disease progresses, patients may feel unusually tired, lose weight for no reason, and sweat a lot, especially at night. The spleen can become enlarged, and this can cause fullness or a dragging sensation in the left side of your tummy. In CML, you may have a lot of white blood cells, but they don't function normally, and so issues like infections or bleeding usually happen in later stages. A complete blood count with a peripheral smear is the first test and shows a very high count of white blood cells. Next, a sample of the bone marrow is taken to confirm that the marrow is hyperactive and crowded with these abnormal cancer cells. The confirmatory test is detection of the Philadelphia chromosome, BCR-ABL1 gene or the protein, which is done using tests like PCR or FISH. CML has three phases: chronic, accelerated, and blast phase. In the chronic phase, the cancer grows slowly. In the accelerated phase, it becomes more active, and in the blast phase, the cells divide very quickly. The main treatment for all these phases is medicines called tyrosine kinase inhibitors or TKIs. There are 5 main TKIs: imatinib, dasatinib, nilotinib, bosutinib, and ponatinib. Names may be tough, but just know that some TKIs are usually used in the chronic phase, while others are preferred in the accelerated or blast phase. These medicines block the BCR-ABL1 protein and control the overproduction of white blood cells. We check if the medicines are working using a PCR test, usually done every 3 months. Most patients respond very well to these TKIs and can live almost normal lives. If one TKI does not work or causes side effects, we can switch to another TKI. Bone marrow or stem cell transplantation is mostly reserved for people who don't respond to TKIs or are in advanced stages. In summary, CML happens because of a genetic change which makes the bone marrow produce too many white blood cells. Symptoms include tiredness, weight loss, and a feeling of fullness on the left side from an enlarged spleen. Diagnosis starts with a complete blood count, then a bone marrow exam and detection of the BCR-ABL1 gene or protein using PCR or FISH. The main treatment is tyrosine kinase inhibitors, which control the disease. Most patients respond well and live almost normal lives. That brings us to the end of the video. Thank you for your time. If you found the video informative, please share it with your family and friends. If you are new here, please check out my other videos and subscribe to the channel. We will meet again with another important topic. Until then, take care.